radical new measures against COVID-19, and that could soon be the new normal for other countries fighting the virus. But experts say a number of unique factors in the United States, a sluggish approach to testing, and a lack of public health care and paid sick days for home workers are likely to make its battle to contain the outbreak even more difficult than Europe. The situation is worse for the United States. Francis Below, a professor of computational systems biology at University College London, told Vice News, quote, "The U.S. is a special case. Despite the U.S. government's pledges to ramp up testing capacity, it appeared that far fewer tests were being carried out in the United States than in other affected countries in Europe. There's very little testing. It's lagged quite badly behind," he said. "There's a lot of unknowns. Exact figures are difficult to establish since the Centers for Disease Control and Prevention said last week that it would no longer provide an official tally of tests conducted under the investigation because states and private institutions had been authorized to conduct their own tests. But an analysis by The Atlantic published Friday could only confirm 1,895 tests carried out in the United States, where the number of confirmed COVID-19 cases passed 550 on Monday. By contrast, in the UK, where 319 cases have been confirmed, health authorities have conducted more than 20,000 tests. William Schaffner, professor of preventative medicine and infectious diseases at the Vanderbilt University School of Medicine, told Al Jazeera that problems with the U.S. testing system meant the country lagged behind much of the rest of the world when it came to testing. "We don't know yet in the United States whether the coronavirus is widely distributed or whether it is just present in certain small spots," he said. Below said the lack of a public healthcare system and of guaranteed paid sick leave for all workers would also hamper efforts to respond to the outbreak in the United States. It will make it much more difficult to convince people to self-isolate and impose the required social distancing methods, said Below. So in a multitude of ways, we are uniquely positioned to be worse off than Italy. And it's scary. So basically, when it comes to testing, we're kind of in the dark. We don't necessarily know the full scope of COVID-19 in the United States because we're not conducting as many tests as other countries are. So the problem could be more widespread than we know, but we don't have access to tests. Like, ask yourself this: if you feel as if you want a test, do you know how you would get a test? Has your private health insurance provider reached out to you? A lot of us have no idea what to do. So there's that. On top of it, the fact that we don't have a guaranteed paid sick leave means that people are forced to go into work. Now, hopefully that will change. Hopefully these private companies will realize that they are stupid to force their workers to work if they are in an industry that is non-essential, right? But at the end of the day, capital is the most important thing. So they're not going to jeopardize their profits. So that's another issue, right? Workers they can't stay home because they're afraid that they'd lose their jobs. And even if they weren't afraid that they'd be fired, they'd lose money. So we're in this situation where having basically no social safety net makes us uniquely vulnerable in comparison with other developed countries, and that's something that has to change. We can't do this. We can't continue to pretend as if not having Medicare for all is acceptable. We can't continue to pretend that not having paid sick leave and looking out for workers, more generally speaking, isn't going to hurt us. I mean, with climate change upon us, this could be the first of many global pandemics that we're dealing with. So we have to arm ourselves with the capability to stay home if the government says we should be practicing social distancing. But the fact that that's not something that people can do because of the economic system that we have built, it makes it, really bad. Where, we see how bad it is in Italy and can only speculate how bad it's going to get here in the United States. And just the thought that we don't have, makeshift facilities built to accommodate hospitals that will undoubtedly be overburdened if this gets worse. The fact that we're looking at a shortage of ventilators and not acting immediately. What do we do? We get to a situation where you're literally choosing who lives and dies. That's horrifying. We should be prepared for this. We should be able to deal with this. But the fact that we're not, and the fact that it's so bad in Italy, and it could be worse here, that's really scary, and it's something that we have to deal with. And as much as we can, we have to try to stay home, self-quarantine, But, I just want people to understand, like, I'm not doing this video to scare people. I want you to realize that, we have to do everything in our power to make sure that it doesn't get to the point that it is in Italy. And a lot of us, that's not in our control, right? This is something that the government and governments, state governments, local governments have to do. They have to take action. But if it gets to a point where it's like Italy, it's going to be worse for us than it is in Italy because of the way our system is built. So just pace yourselves. We don't know how long this is going to last, but whatever you can do to protect yourself, do it.